Welcome back to another episode of Victorians Exposed. Clitoridectomy and other forms of female genital mutilation are horrifying medical procedures which still take place today, but the first recorded clitoridectomy in the Western world was actually performed in 1822, and in the 1860s Isaac Baker Brown would try to bring clitoridectomy into the mainstream medical practice, and would spark one of the most heated medical controversies of the 19th century. Isaac Baker Brown was one of the most famous medical surgeons in the mid-19th century. However, when he published his findings on clitoridectomy in 1866, his peers were outraged and he was expelled from the London Obstetric Society. However, it wasn't the extremity of the operation, but rather the unprofessional way in which Baker Brown handled the matter that caused the medical community to protest so strongly. Practitioners argued over the validity of the operation and whether or not it even provided a cure for the patients in question. After almost a year of debate, Baker Brown agreed to come before the London Obstetric Society to present his case, a trial which would result in him being expelled. What really angered the medical community was the fact that Baker Brown had made it very easy for women to come across his findings on masturbation and clitoridectomy. By doing so, Baker Brown had deliberately trespassed over the boundary that kept knowledge of such subjects strictly within the ranks of medical men. Furthermore, the binding that Baker Brown used for his book was indistinguishable from that of non-medical literature. The British Medical Journal even said that they felt bound to observe that serious medical work on the subject of female masturbation should bear on its outward faces none of the characters that belong to the class of works which lie upon drawing room tables. Basically, the cover was a bit racy. Aside from this, it was the fact that Baker Brown brought Victorian women closer to the subject of female masturbation through the promotion of his cure, which can all be shown by the fact that the president of the Obstetric Society said to Baker Brown, "It is the manner in which the operation is performed, not the operation itself." The fear of appearing unethical rose from the fact that in the 19th century there existed a medical marketplace in which patients could choose from a number of competing practitioners. Because of this, having a flawless or even just a good reputation was very important to individual doctors and the practices that they were associated with. This was even more important in the branch of obstetrics, as doctors were seen as the guardians of women's health and the custodians of their honour. Whilst gynecologists and obstetricians had an extraordinary amount of power over women, their ability to exercise this power would quickly evaporate if they should use their authority in an unethical or unprofessional way. Baker Brown, however, did not share this view. Rather than be constrained by these social and moral regulations, he was more concerned with preventing the diseases that he insisted were caused by female masturbation. In his mind, Baker Brown was simply restoring women to their proper role of dutiful wife and mother. In his book, he points to several case studies where his patients had a distaste for intercourse and their husbands in general, and would rather spend their days masturbating than fulfill their appropriate social role. After the operation, his patients gave up on their own independent sexual needs, resumed relationships with their husbands, and became docile childbearers. But while Baker Brown was concerned with women fulfilling their roles as wives, his medical peers were more concerned with them becoming wives in the first place. They were concerned that the lack of a clitoris would stain patients with a mark of excessive sexuality and prevent them from entering into respectable marriages. Other solutions to female masturbation, some of which were equally as brutal as clitoridectomy, did not leave visible signs of treatment on the patient. One of the main arguments against clitoridectomy was that some practitioners believed that the surgical removal of the clitoris was the equivalent to the amputation of the penis. But when Dr. Harry Gage Moore wrote to the Lancet in 1866 to put this idea forward, his view was quickly ridiculed. Dr. Geo Gandil Bantock even says, "Is Mr. Moore truly serious? Does he mean to imply that the excision of the clitoris is the equivalent to the amputation of the penis? If he does, I shall not argue against the physiological error implied by such an analogy, but simply beg that he refer to his textbooks." Burn! While some doctors did agree with Moore's opinion, most of them joined Gandil Bantock in ridiculing such an outdated medical view. Whilst the penis is a key player in male sexual pleasure, it is also essential in terms of reproduction. The clitoris, however, plays no role in reproduction, and Baker Brown used this argument to justify his actions to those critics who thought that the operation would detract from a woman's inherent femininity. Because of the ethical implications associated with clitoridectomy, many of Baker Brown's opponents simply could not let the issue go. The London Obstetric Society was not convinced by Baker Brown's argument, and over 80% of them voted for his expulsion from the society immediately. Whilst clitoridectomy has never been part of mainstream Western medical practice, the operation has always been performed in several cultures across the world. Interestingly, these modern communities use the same justifications for clitoridectomy that Isaac Baker Brown did, namely the suppression of promiscuity, the preservation of virginity, but most importantly, the prevention of female masturbation and the repression of female sexuality. Thanks for watching everyone. Don't forget you can click here to watch the last episode of Victorians Exposed, and if you don't want to miss any of our videos, don't forget to subscribe. We'll see you next time.